Welcome to the deep dive. We're here to tackle those complex health topics and, well, really pull out the key insights you need. Today, we're jumping into something that's both medically intricate and deeply personal, the fertility journey.
Yeah, it's a journey that for so many people feels overwhelming. There's
Yeah.
just so much information, so much stress. So
Ah,
our aim here is to really distill how integrating complementary approaches, specifically, we're talking acupuncture and herbal treatments, works with conventional fertility care. And we're looking at a model that's actually gaining some serious traction in the medical world.
definitely. And our sources today, they're centered on a really interesting place, the Berkeley Center for Reproductive Wellness in New York. We're focusing on the work of Mike Berkeley. He's a licensed acupuncturist, a fellow of the American Board of Oriental Reproductive Medicine, and really a pioneer, apparently the first acupuncturist in the U.S. to focus exclusively on fertility. His center's been doing this for, over 20 years now? He basically wrote the playbook.
That's right. And it's important to frame this correctly, I think. This isn't about replacing conventional medicine,
Yeah.
not at all. It's about a structured, integrative model. Think Eastern wisdom working hand in hand with Western protocols. The goal is purely optimizing the biological environment for success, whether that's conceiving naturally or using RT, like IVF.
Okay. So let's unpack that core mechanism right away. You hear acupuncture for fertility, and honestly, the first thing most people think is just stress reduction. And our sources do say, yes, stress reduction is definitely part of it, a vital part. But physiologically,
Hmm.
what's actually happening in the body, specifically for women?
Well, the research really points to blood flow. That seems to be a primary mechanism. We're talking about a significant increase in blood flow, specifically to the ovaries and the uterus.
Okay, so more blood flow means.
It means better nutrient delivery, better oxygenation. Think about it. The ovaries need that rich supply to produce high-quality eggs. And the uterus needs good circulation to build a healthy lining for implantation. Sometimes, especially with age or stress, that circulation can be, well, sluggish. Acupuncture seems to act almost like a vasodilator in those specific areas, really optimizing that microenvironment.
Got it. So it's not just feeling relaxed, it's physically changing the conditions, improving the infrastructure, basically.
Exactly, the infrastructure. And that improvement extends to hormones, too. Acupuncture appears quite effective at helping regulate the HPO axis, that's the hypothalamic pituitary ovarian axis, the control center for reproductive hormones. By sort of calming and balancing that system, it can help normalize ovulation cycles, makes the body more predictable, whether you're trying naturally or using meds for IVF.
Mm-hmm. And what about those really tough diagnoses like PCOS or endometriosis? They often feel like such major hurdles.
Right. For conditions like PCOS and endometriosis, the focus often shifts a bit. It's about tackling chronic inflammation and sometimes insulin resistance. Acupuncture is used quite specifically to try and reduce that systemic inflammation. Quieting down the environment can make implantation less difficult. It's also aimed at addressing some of the hormonal chaos that often comes with those conditions.
Now, here's something often missed, I think. Fertility struggles aren't just about women, are they? What do the sources say about male factor infertility? This is critical.
Oh, absolutely critical. The material is very clear. This needs to be a two-person strategy. Acupuncture shows demonstrable benefits for male factor issues. It works on improving the key semen parameters. Count, volume, motility. That's how well the sperm swim. And morphology, which is their shape.
So better sperm quality overall.
Exactly. When you optimize sperm development over that crucial time window, you increase the percentage of viable, healthy sperm. And that directly impacts the chances of fertilization and a healthy pregnancy.
That dual approach makes perfect sense. And it leads us right into this idea of integration. The sources keep talking about using these methods with Western medicine, especially IVF. So for someone already on the RTF path, what does that integration look like in practice?
This is where you really see the synergy.
Right.
Acupuncture isn't just a general add-on. It's timed very precisely with IVF cycles.
Right.
And studies suggest that when used together, it can actually improve overall IVF success rates. It's not just about the egg and sperm quality we mentioned.
Right.
It's also about enhancing that uterine environment, improving the thickness and the receptivity of the lining. That's absolutely essential for an embryo to implant successfully.
And the timing can be incredibly specific, can it? The sources mention that.
Oh, extremely specific. The Berkeley Center, for instance, offers pre- and post-embryo transfer acupuncture. These sessions are super time sensitive. Sometimes they need to happen within just a few hours of the actual transfer procedure. So to make that work, they're available basically 24/7, 7 days a week in Manhattan for those really critical implantation-focused treatments.
Wow, okay. That level of availability highlights the commitment. Which brings me to the next point, the duration. Twice a week for 3 months. That sounds intense,
Yeah.
emotionally, financially, time-wise. How do the sources justify that commitment, especially to someone who might already feel totally burnt out by appointments?
Yeah, that's a fair question, and it gets right to the biological reasoning. It's fundamental. That 3-month period, it's not arbitrary. It's based entirely on biology specifically, gametogenesis. It takes roughly 90 days, 3 full months, for an immature egg cell, a new site, or an immature sperm cell to develop and mature fully.
Ah, okay. So you're treating the development process.
Precisely. If you want to influence the quality of the egg or sperm that will be involved in conception, whether natural or via IVF retrieval, you have to start treatment at least 3 months before. You're not just treating symptoms day of.
Yeah.
You're proactively trying to optimize the quality of the cells themselves.
So if you start later, you've essentially missed the window to influence that specific batch of eggs or sperm.
That's the rationale, yes. And it's not just needles. The sources also highlight a couple of other tools in their kit. There's customized herbal medicine working from the inside out to support the system, maybe reduce oxidative stress, things like that. And they also use something called low-level light therapy, or LLLT.
LLT. Okay, that sounds pretty high tech, like light therapy for fertility. How does that work?
Yeah, it does sound a bit sci-fi, doesn't it? But there's a theory behind it, connecting Eastern and Western ideas. Basically, as egg cells age, their mitochondria, the little energy factories inside the cell, can become less efficient. This impacts egg quality, especially in older patients. LLLT involves applying specific wavelengths of light, usually near infrared, to the abdominal area over the ovaries. The idea is that this light energy might stimulate mitochondrial function, kind of giving those aging egg cells an energy boost, promoting better follicular development and, hopefully, better quality eggs.
Interesting. Boosting the cell's own energy production.
That's the concept. And importantly, the sources stress that when performed by licensed, experienced practitioners, this whole toolkit acupuncture, herbs, LLLT is considered safe for women trying to conceive, with no significant side effects reported.
Okay, safety is key. Now, before we get into the personal stories, one detail about the commitment timeline stood out. Treating patients until week 13 of pregnancy. Why that specific point?
Yes. That's about miscarriage prevention, primarily. It's a really critical point. The data shows that something like 90% of miscarriages happen by or before the end of week 12. So, providing continued supportive care with acupuncture through that vulnerable first trimester aims to help stabilize the pregnancy, support hormone levels, and potentially reduce the risk during that major danger zone.
Right, okay. That makes a lot of sense. So let's shift to the practitioner himself. Mike Berkeley's own story is pretty compelling, a classic case of skeptic turned true believer.
It really is. It apparently started from a place of deep personal struggle and, frankly, cynicism. He and his wife were facing infertility. He was, I gather, working a high-stress job, totally dismissive of acupuncture.
Mm-hmm.
Their diagnosis was tough. He had issues with sperm morphology and motility, and she had anti-sperm antibodies, a double whammy. After years of frustration and failed attempts, his wife found an acupuncturist and herbalist. She eventually persuaded him, the ultimate skeptic, to go for treatment too.
That must have taken some convincing.
You bet. But they both committed. They did that 3-month protocol we talked about, and well, it worked. 3 months later, his wife conceived naturally. They have a son now. And that experience, that complete turnaround against the odds, was apparently the catalyst. It led him to completely change careers and dedicate, 6 years to intensively studying acupuncture and Chinese medicine. He wanted to figure out how to replicate that success for others. That's quite the origin story. And it leads us to the results for others. Margot's testimonial in the sources. Wow. It starts from such a difficult place, a place many listeners might recognize, and then there's this incredible shift. Can you walk us through her specifics?
Margot's case is powerful. She was 39, and her numbers were daunting. An FSH level of 21.
Which is very high.
Very high, yeah. It signals the ovaries are struggling. And her AMH was 0.12.
Extremely low, diminished ovarian reserve, basically.
Exactly. Clinically defined as severely diminished ovarian reserve. Very few eggs left. And the quality was presumed to be low. On top of that, her husband had his own issues, low count, poor motility, and sperm DNA fragmentation. So, challenges on both sides.
That's just a heartbreaking prognosis to receive. So tough.
Incredibly tough. And they went through it. 3 grueling rounds of IVF egg retrieval. The result, only 2 embryos made it to the blastocyst stage, which you need for transfer. And then the final blow. Pre-implantation genetic testing, PGTA, showed both were chromosomally abnormal, unviable. Oh, man. That PGTA result, after everything. That's often where hope just shatters for people.
Absolutely devastating. But instead of giving up, Margot decided to pivot entirely to this intensive, integrated approach. She committed fully 5 months of customized acupuncture and herbal medicine at the Berkeley Center. Then she went for a fourth IVF retrieval. This time, 6 eggs retrieved a better number for her. That resulted in 3 blastocysts. And here's the kicker, the real aha moment. All 3 blastocysts tested chromosomally normal after PGTA.
All 3, from 0 normals to 3.
All 3 normal. It's a remarkable turnaround, statistically speaking. And the update in the source was that she was 37 weeks pregnant at the time. That shift from 0 viable embryos to 3. That's the kind of outcome data that really makes you pay attention to the potential of this integrative model.
Wow. And Margaret's story also mentioned the care itself, describing the practitioner almost like a therapist, a cheerleader. What did other patient stories say about the experience of care there?
Yeah, that compassionate aspect comes up repeatedly in the patient feedback. People consistently describe the practitioners as knowledgeable, yes, but also incredibly attentive and compassionate. They talk about feeling like they were in a safe space, which is so important during such a vulnerable, often isolating journey. Feeling genuinely heard, feeling like the practitioner was truly invested in their success, not just going through the motions.
And there was that interesting anecdote about honesty, about ethical practice. That stood out.
Right. That one patient who, after finally getting pregnant, wanted to keep coming for sessions past week 12, just for reassurance, willing to pay. And the practitioner apparently declined, explaining that the research just doesn't support a clinical benefit beyond that 12 or 13-week mark for miscarriage prevention. That kind of honesty, putting the patient's actual needs and finances ahead of potential revenue, that really builds trust. It speaks volumes, I think.
It really does. Now, seeing Eastern and Western medical pros working together so closely, especially in a field like reproductive medicine, isn't always common. What did the sources say about the center's reputation among conventional MDs?
There was another striking aspect. The credibility seems quite high. We're not just talking anecdotal mentions. The sources include recommendations from multiple medical doctors, reproductive endocrinologists, REIs, owners of major NYC fertility clinics, even an associate dean from Weill Cornell Medical College. These are established figures in conventional medicine vouching for this integrative approach.
And what specific things were they praising Mike Berkeley for?
Several things. His deep understanding of reproductive endocrinology and infertility itself. One MD even commented he probably reads more REI literature than many active REIs do. Also, his ability to tailor the acupuncture and herbal protocols to complement the specific IVF protocol the patient's REI is using. So they work in sync, not at cross purposes, and recognition is a genuine pioneer in integrative reproductive medicine. He helped design the ABORM certification, for example. He's seen by many in the field as a specialist peer.
Okay, so a high degree of professional respect there. Finally, beyond the treatments themselves, the acupuncture, the herbs, the light therapy, what about lifestyle? What non-medical factors did the sources stress are crucial for success?
They really emphasize that this is a partnership, and the patient's lifestyle is a huge part of the equation. It's non-negotiable, really. We're talking about the fundamentals. Adopting a clean, healthy diet, maintaining a healthy weight, actively managing stress through things like yoga or meditation, and, crucially, avoiding alcohol and smoking completely. The treatments can help optimize the biology? Absolutely. But the patient has to provide the best possible foundation for that optimization to work effectively.
Right. It's a truly holistic approach in that sense. So this deep dive, it really underscores that personalized integrative fertility treatment goes way beyond just relaxing. It's targeting fundamental biology, blood flow, hormones, inflammation, even cellular energy, like with LLLT. And we saw in Margot's case how it can potentially shift outcomes dramatically, even when the initial prognosis looks bleak.
Exactly. I think the big takeaway from these sources is that achieving the best possible fertility outcomes often means moving beyond looking for a single magic bullet. It suggests that a comprehensive strategy, one that intelligently blends ancient wisdom like acupuncture with modern medical diagnostics and treatments, might be the most effective path forward for many people.
A powerful case for personalized, sustained, collaborative care. Which leads to a final thought for you, our listener. We heard how crucial that supportive care is through week 13, specifically aimed at miscarriage prevention during that most vulnerable window. So, thinking about that model continuous holistic support during a critical phase, what could that inspire in other complex health areas? Think about chronic conditions or maybe long-term recovery after major illness like cancer. How could that kind of sustained integrative support model make a difference there? Something to consider until our next deep dive.